Hello everyone. I hope I'm visible to all. So hereby we are starting this International Webinar 2020. I feel privileged and to extend a warm welcome to all present here. Thank you for joining with us in this webinar 2020 on COVID-19, Veracity and Felicity. My name is Pragati Srivastav Robin and I am an associate professor at Bethany College of Nursing, Durg. It gives me immense pleasure to introduce our honorable speakers who are joining with us today. Mrs. Bindu Varghese, Mrs. Rija Abraham, and all the way from Bahrain, Mrs. Shilpa Pushpan. Mrs. Bindu Varghese and Mrs. Rija Pratik is from UK, and Mrs. Shilpa Pushpan is joining all along with us from the Kingdom of Bahrain. Welcome, ma'ams. Every loss of life is a tragedy. Today, we all are alarmed by the outbreak of a disease named coronavirus, which first happened to appear in the year 2019, hence also known as COVID 19. This webinar, COVID 19, Veracity and Felicity, has been organized to put a light on how this disease has created a global health crisis and has been impacting our everyday lives. Today, as we are connected here through this webinar, we would like to pay a small tribute by dedicating this webinar in the honor of all the healthcare workers across the world, which includes the doctors, the nurses, and other paramedical staff who are working on the front line fighting this pandemic by putting their own lives at risk by saving ours. You are the heroes, the warriors, and we humbly thank you. Now, I would like to request our director, Reverend Father Siju Matthew OIC, to address our esteemed speakers and the live participants.
Thank you, Pragati. Good morning, one and all who are taking part in this seminar. The topic of this webinar is, as we know, COVID-19, veracity and felicity. Veracity, the word itself tells, it describes the apprehensions, the truths, or the felicities that are there. A lot of rumors are there about COVID, and also people are also frightened about it. It has completely changed the outlook of people. Even this webinar is an outcome of that. Earlier, thinking about webinars would be some sort of wrong thing, or it was not a usual thing. But COVID has made us to adapt to such changes. And in today's seminar, we have people from different places taking part and listening to us. We have three eminent speakers who are going through or experiencing different people in the profession, and they are also able to give hope to those people. They very well know because they are into that. So I would like to first welcome the speakers of the day, Mrs. Bindu Varghese from Essex, UK, United Kingdom, and also Mrs. Rija Abraham Pratik, also from Essex, United Kingdom, Mrs. Shilpa Pushpan from the Kingdom of Bahrain, all contributing in their own way to the best of their abilities. One of the novels begins, speaking about French Revolution. It was the best of times and bad of times. Yes, COVID is the best of time and bad of times. It has brought a lot of changes. It has made people unsettled. It has made people to think out of the box, and people are expecting many more things to happen in this world. But at the same time, people are going back, reflecting about their lives, trying to be innovative, trying to change. And I think so, Charles Dickens, those words are very apt for the today. And I know for sure all the three eminent speakers will be able to guide this webinar in a fruitful way. And I congratulate you all for taking this task and responsibility on behalf of our management, staff, and the college for the wonderful service you are doing. And I also would like to welcome all the people who are attending the webinar. Though it is difficult to name everyone, we are not able to see everyone together, but we know surely it will be a fruitful one. And it is the grace of God that we have got such good speakers to guide us. And once again, a warm welcome to everyone. I would like to congratulate all the teachers, principal ma'am, vice principal, and all the teachers who have put a lot of effort into it, and also our staff who have been constantly helping them. It is a teamwork that has resulted in this. And I would once again pray that let this seminar be a fruitful one. God bless you. Have a nice day.
Thank you, Father. Now, I request our principal, Professor Dr. Mrs. Benny Susan Chacko, to unveil the theme of this webinar.
Good morning to all. Distinguished guests, delegates, participants from different parts of country, Father Shiju Matthew OIC, our director, Bethany College of Nursing, Father Elias, John Elias, Barsar, Bethany College of Nursing. I, Professor Dr. Mrs. Benny Susan Chacko, Principal, would like to unveil the theme of our first international webinar 2020. Challenges are what makes life interesting, and overcoming them is what makes life meaningful. COVID-19 or coronavirus is a contagious disease, and yet we do not have concrete solution to manage this pandemic effectively, which has become a primary challenge for all of us. Nurses' role are now more important than ever. Nurses are often the last thread of compassion for the patient. Nurses are the one who receives the patient, doing screening, taking care of the critical ill, mediators between the patient and family members, implementing triage protocols, last but not the least, attending the dying. Nurses are the one facing tremendous work-related stress, burns out due to the workload, and long working hours due to the staff shortage. Many of them got infected, and some lost their life caring for the patients and their loved ones. Stories and experiences of nurses from various parts of the countries inspired us to come forward with this theme, COVID-19, Veracity and Felicity. Veracity, the habit of telling the truth. Felicity, the ability to find the appropriate expression for one's thoughts. In initial phase, people went through the stressful situation, particularly the frontline workers. Hats off to all brothers and sisters of our profession who, with full enthusiasm and courage, took the challenge and worked globally. First session will be dealt by Mrs. Bindu Verghese, MSc RN, Essex, UK. COVID-19, what we know, what we are learning. Ma'am will be dealing with the strategies used for managing the current crisis. Second session by Mrs. Rija Abraham Pratik, MSc RN, Essex, UK. Not all wounds are visible. Ma'am will be dealing with the post-traumatic disorders, stress disorders and its management. Third session will be dealt by Mrs. Shilpa Puspan, MSc RN, Kingdom of Bahrain, overcoming the quarantine blues. Ma'am will be dealing the stressors during the quarantine period. I officially open this webinar wishing you all an informative session. Have a wonderful day. Thank you.
Thank you, ma'am. Before we begin the webinar, here is a genial request to the participant coming live. If you have any questions during the presentation, kindly drop them into the comment box which you can find right below your screen, and it shall be addressed to at the end of the presentation by the honorable speakers. Thank you. Without taking more time, I would now call upon the moderators to extend a special welcome to our honorable guest speakers and also to put a light on their expertise in the field of nursing. Now, I would like to request Mrs. Sunita Wesley to moderate the first session.
Good morning, everybody. We are going to start our first session for this international webinar. The topic is COVID 19, what we know, what we are learning. I'm Mrs. Sunita Wesley, the head of the Department of Medical Surgical Nursing, who will be moderating this session. This session will be taken by Mrs. Bindu Verghese, MSN, RN, Essex, UK. Ma'am has completed her BSc Nursing from Shepherd University in 2008, Masters in Advanced Nurse Practitioner from Anglia Ruskin University, Essex, 2019. Ma'am has completed non-medical prescribing management and leadership, cardiac care assessment and consultation. Ma'am has worked as registered nurse in SDMH Jaipur from 1999 to 2003, registered nurse in Sheffield Hospital, United Kingdom from 2004. Currently, ma'am is working as clinical site management manager, NHS Trust Essex, and also working as urgent care practitioner for NSH 111 out of hours services. Now I request ma'am to take over the session and lead us. Thank you.
Good morning, everybody. I would like to thank everybody for giving me this opportunity, especially to the Bethany College of Nursing. I hope this session will be useful for all the students and who are going to be the future leaders. My session will be about compassionate leadership during this COVID period, and I'll be talking about my experience during this COVID period in the end. Next slide, please. COVID-19 Leadership Guide. So COVID-19 pandemic has placed a huge pressure on the availability of NHS to deliver safe and high quality care. So it is affected each and every member of the healthcare system, the doctors, cleaners, all frontline workers who have been working together as a team to face this COVID-19 situation crisis we are facing now. It has become a bit better now in UK, but it's still ongoing process. It's we still know that it's among us, and we are facing a new challenge every day. So in order to face this COVID-19 problems and the crisis we are going through, it is very important for a leader who who is making plans, who's making changes in the way of working, and they are in forefront of what they are doing. So my session will be dealing with compassionate leader, because the staff in general is very stressed, they are very anxious, they are frightened. So compassionate leadership is the most important way the people can feel how when they are frightened, they are overwhelmed. Leaders need to focus on compassion so that they can provide health and care service to all grades, irrespective of their grade or role, whatever they are doing. Each and every job is very important, and it is the team working, it is the compassionate leadership who can bring us all across these problems. Next stage slide, please. So compassionate leadership enhances the inner motivation of the staff, and it reinforces the morale, which can help the culture of learning for each and everybody. Leaders draw upon all available resources, utilizing the collective intelligence and experience of the staff, and while adapting according to the situation. We are adapting ourselves every day. In order to gain collective wisdom, we require compassionate leadership. So how can we do it as a leader? By paying attention to what we do, how we do it, by listening to the each and every staff member, whatever the grade they are, and being a visible leader by role modeling and being present with them during this crisis period, and truly understanding the challenges the staff is facing. The leaders need to empathize with them, and they need to take responsibility for helping and to be able to deliver high quality care. Leaders, the job of a leader who is standing in front, it's very challenging, and it takes a courage, inner strength to commit to be a compassionate leadership rather than following a command and a control leadership style. As a leader, we need to empathize with the staff, feeling their fear, stress, and uncertainties, the anxiety which comes with this COVID-19 crisis, because we never have faced this crisis before. We don't know much about this crisis. So, providing a motivation to ask, how, as a leader, how can I help you, is the most important task for the leader. The leaders provide a positive, caring, and supporting environment, so they are able to increase the staff. They can sustain the multidisciplinary team working, where everybody is clear about their role and what they are doing and still working as a team. So, I would like to say that daily briefing hurdles, regular time for the counseling learning process to bring all the staff together has helped to work together and improve the team working, and has helped to bring about changes in new ways of innovation, new ways of working style, more of virtual help and technical help rather than doing the face-to-face consultation and assessments. Lots of changes have been brought in NHS, and there is every day there's a new change. So that's been quite important, and it has increased our cross boundary working, and in a way the working has been transformed in the ways that was unimaginable a few months back. So we've changed a lot of things around how we worked, how we did uh, work around this area. So I would like to go on saying that how important is for the leaders to be in the belonging, to belong, and to be in a human well-being is the main need for this crisis during this COVID period. Everybody is feeling overwhelmed, frightened, and this is the situation we are feeling. So it is very important that we as a team at work feel belonged, and it is the same as the we need extra support, we need belonging, where we feel that we have got the support system at home also. We need to give importance to our care for looking after ourselves and looking after families, and in the same way we look after the patients and work as a um, professional person. Next slide, please. So all staff are desperately wanting to deliver high quality care during this pandemic. The leaders have to need to be enable and support the staff to work effectively during what is this is a very testing and prolonged period. Next slide, please. So the challenges we are facing, the time is very pressured, and we, as an NHS staff, we have been already were in a clinical burnout period, and to face a new challenge has been extremely difficult, overwhelmed. But the planning and strategical operation and changes in the way we work has brought a lot of change, and managed we've managed to get through along with a lot of work from each and every member of this team. So staff need to meet with, the most important thing is the leaders and the staff need to meet each other. They need to have regular reviews. They have to share their learnings. They have to come with innovative plans to overcome this crisis and simply regain themselves, regain their strength, l- to be able to look after themselves. We created lots of well-being and staff well-being um, sessions, counseling sessions, learning sessions, and uh, most of the our staff have been working in different departments. They've been retrained. They had their competencies redone again. So it's worked together in a better way, that we have faced this challenge, and we have come with new ways of learning and doing things. Next slide, please. So uh, for us, working in NHS has been always be a challenging and difficult job, but during this COVID period, it has been extremely difficult. First, we were not sure what was happening. First, there was thoughts about it was like a normal flu symptoms, but when things got worse in Italy, and we started preparing ourselves, most of the wards were closed. We changed the wards into COVID wards, the red areas. There was different ways of working. So the worst things when it started to emerge was there was thoughts that it's going to be affecting more of elderly population, but then all of a sudden we started a surge of young um, people who became really unwell, and out of those young people who were dying and in their middle age, there were lots of BAME stuff and patients as well. So BAME, I'm just going to expand that. It is Black Asian minority ethnic group, and out of that, Black Caribbean group, Asians, especially Indians, Pakistani, Bangladeshi, and Filipino nurses were were the frontline staff and doctors who lost, unfortunately, to those COVID situations. So it was extremely difficult and uh, um, emotionally draining for us to see our colleagues, our friends, who are people who are younger than you, in on ventilators and on ICU. Some of them were able to make through this. Some unfortunately lost their lives. So we as a NHS in total have observed 1 minute silence to pay respect to all the NHS staff who have lost their lives to COVID-19. uh, I, I, I hope that we never forget this experience, and we always remember them, because they have left behind friends, families, and colleagues that have been now still grieving. These are NHS staff. These are people who had their families, friends. So, what is the cause? What was the reason for this group to lose so many lives? So, what we found was this disappropriate mortality and mobility among Black, Asian, and ethnic minority people, which included senior doctors, NHS nursing staff who contracted this COVID-19. We are still trying to find out the reasons behind it. There can be social, economical factor, their health conditions in general, being diabetic, hypertension, obesity, housing facilities, and there's lots of different factors which can be specific reason for this, but we are not really sure. We are trying to find out, and we are trying to find out this what we are tried now, as soon as we found that they are the highest risk group. We've started a risk assessment on all the staff who are working in the hospital across the NHS, and especially the BMI group have had the risk assessment done. They have been deployed according to the health conditions and according to the needs, and they have been given extra protection, and they've been shielded. They have been asked to work from home, and the different working method has been followed to help them go through this crisis especially. Next slide, please. So, as I said, improved risk assessment has been started, and we are doing the precautionary assessment for all the staff, and all the paperwork is all the assessment goes to the infection control team. They look into it, they try to deploy it, and they raise concerns. And majority of there is always anxiety, there is always fear, and but we need to be able to speak to somebody who is able to listen to these issues, and uh, that's mostly your line manager or a senior uh, matron or a leader in that your particular area. But then we have started developing the freedom to speak guardian who are out of the they don't work with the same department, but they are external people, but they are where the staff feel that they are able to go to them, they can raise concerns. So it is quite important that we have a open communication. We have support system in place, so that staff and even the leaders, they need to talk about their feelings. It's not um, we've never been prepared for this, so and we never will be. We can do our best. That's how we can deal with this situation. So going back on my experience as a clinical site manager in the NHS Trust is, we brought lots of changes in the working style. So our accident and emergency, um, there was lots of information out to the public, general public, to avoid any unless they needed to come in. During the COVID periods, the patients was asked to stay at home if they had symptoms. They had their regular swabs done, and all the uh, um, all all the care was given to them on phone where it was manageable. But only patients who were really unwell, they ended up coming to accident emergency, and which helped us um, to create more beds for the patients who really needed to be in hospital. So our A&E was divided into the red zone, which was the COVID, um, with this different entrance. We had a green zone and green areas, which is for non-COVID patients who are coming through. So most of the wards, uh, in the beginning of March, April, most of the wards were turned into COVID wards. We had only one or two normal medical or surgical wards, but rest of the wards were all COVID patients, and the anxiety among the staff was enormous. um, there was anxiety about what PPIs to use, how to use them, how we can look after the patients, and at the same time look after ourselves and our family members. When we go back, there was always that the uncertainty. Am I going to come back tomorrow? How well I am? So it was very important as a leader to be able to convey that reassurance, to keep their motivation in, to create the positiveness. So any patient who came out of ICU, who was intubated, who was very unwell, they had, and all the patients who were in hospital, they didn't have any family members to visit them. There was strict no visiting rules. So the patients relied on the nursing staff, they relied on the healthcare workers to have that confidence that they belong, and they got that support system. So it was very difficult, especially it was very difficult for the nursing staff as well, for the patients who were dying, who were towards going towards the end of life, to be left alone with nobody, no family member to talk to, or just to talk about their fears. And this, it was extremely difficult for the nursing staff as well. So there was times where staff were crying, and there was times where even the senior management was in tears. They didn't know, it was overwhelming. But as a team together, as we learn from experience, we learn from each other by sharing our learning and experiences. That has brought us together all throughout this crisis. So we brought a lot of changes in our uniform, and how to prevent इन्फेक्शन रिस्क एज वेल. सो हम लोगों ने क्या किया कि स्टाफ को के यूनिफॉर्म्स वगैरह में भी काफ़ी चेंजेस किए. यूनिफॉर्म्स दे चेंज इनटू स्क्रब्स. जो कोविड रिलेटेड एरिया में जो काम करते हैं उनके लिए डिफरेंट कलर का स्क्रब्स थे, जनरल स्टाफ के लिए डिफरेंट स्क्रब्स थे, और दे वर staying in the same area where they were working. So the staff, all the staff members and all the majority of the people were swabbed on daily basis. The staff who were working in green areas, they were swabbed on weekly basis. So एएनए में क्या था कि रेड और ग्रीन एरिया का एंट्रेंस था, और स्टाफ को स्वैप किया गया, हर हफ्ते में उनको स्वैप किया जाता था. फिर उसके बाद में they had a different uniform, they had a support system in place, and majority of the staff felt that they had somebody they could talk to. So engagement with the staff. So staff networking was the most important. We were able to share our experience and share guidance, and that took we had to plan lots of actions uh, that provided support to the staff. And we started different ways of working, as I said before, series of webinars, virtual talks, and support system. There was small sessions every day. All the chief nurses, all the senior management team was working on the floors with the staff. So that was quite helpful, and we felt supported. And in general, the public was very supportive in what NHS staff was facing. They put in lots of charity work and lots of support to the NHS staff. There were loads of food coming out, lots of gifts coming out for the NHS, where there was appreciation, lots of appreciation for NHS staff. And every Thursday we had all the neighborhood would come out. They would clap for the NHS staff for whatever that they were doing. So it was amazing in that sense, and it helped us to go through the difficult stages. Next slide, please. So key issues in considering for the staff. So putting effective communication channels to should be in place to raise awareness about COVID situation, how they are transmitted to the staff members, including cleaning arrangement, facilities arrangement, and the most important thing is to be able to identify how to minimize this risk, how to um, bring about the changes in our practice, how important it is about hand hygiene and different methods, social distancing methods to reduce the transmission. Next slide, please. So ensuring that substance hazard to health, that's COSH, assessment has been reviewed to identify the risk of harm and how we can manage those risks. That's we can never avoid all risks. There is always going to be some sort of risk. So how we can protect it, by using of personal protection equipments, how to contaminate the area, how to look after the equipments, um, how to manage the waste. So there is always a guidelines, and that we follow the public health guidelines in UK, but there is always guidelines and policies and procedure in place. And as a healthcare worker, we need to be able to stand firm and stand together to face this COVID situation, and most important, to follow the guidelines and policies which have been given to us. Next slide, please. So ensuring that adequate PPIs are available for the staff uh, to protect the suspected and the confirmed cases of COVID. There was some anxiety. There was fear about the how which type of PPIs to use, how to use it. There was lots of reassurance, but from from a domestic to cleaner to a senior consultant level. We have all um, gone through the training. We've done fit testing. We have done different things to help. So everybody who enters the hospital now, they have to wear the mask, even whether they are clinical or non-clinical. So there is lots of changes in how we brought about this change and how we managed this COVID situation. Next slide, please. सो जैसे मैंने कहा कि फिट टेस्टिंग वगैरह किया गया था, FFP3 मास्क दिया है most of the staff, and everybody has got FFP3 mask to help them, and how to change, how to drone, things have been taught to all the staff members. From any grade to any ranking. So it is about following the policies and procedures and protecting yourself and doing the risk assessment. Next slide, please. So ensuring effective procedures are in place to allow the staff and representative to raise any concerns at the earliest opportunity is the most important thing. Um, so the expectations are that we are still working in this COVID situation. We are still facing challenges every day. The situation is much better now comparatively, but there is challenges every day. It's there is more economical, financial constraints. The more shops and more public areas are open. The lockdown has been eased off. But as a staff member, the people who have seen really bad in situation during this COVID period, we are still frightened in our heart that we hope that this second phase doesn't come again. We are scared that it doesn't happen again. But the, as I said before, this is the new normal for us, and this we have to risk assess the situation. We have to speak up. We have to stand together, and we need to be communicating with the staff in a way that bring us positiveness in all the staff members, and that's what the compassionate leadership is about. That is about what we do as a nursing staff or the medical team in general. So if there is any concerns, we need people to be around who we can speak to. um, different groups of people, the people who have experience in counseling, to reassure the staff about the anxiety and the fear. The there have been people who've been um, going home. They've been alone at home, and they had nobody to talk to. So that's created a lot of mental health issues, and we are seeing a lot of mental health and challenges, and people have been going um, and losing their lives. They've some of the people have been suicidals. They had there has been drastic increase in the health of mental health of the staff, general public in general, during this COVID lockdown. So we have to constantly think about the ways we can bring about help among the staff in general. Next slide, please. So what I would say it's about bringing about change, bringing new innovation, bringing about um, open communication to the staff members, having to be able to empathize with them, listening to them, how if they've got a better skill mix, how they can work together in a team. So that was the most important thing. Everybody is scared. We've never faced this challenge before, so we are, as we listening to the other things happening in the world, there's lots of other things happening. So I would say yes, we need to be aware about what is happening, about the risk. So I think we can face it all together quite well. Any questions, please? So I would like to thank again for this. Thank you again for having me. Sunita, any questions from anybody?
Yes, ma'am. Thank you so much, ma'am, for the informative session. Ma'am, we
Thank
have
you.
questions, but more or less they're all similar. I'll just summarize the questions in one question and just let you know.
Okay,
The
thank you.
questions are mainly like how will we manage this COVID situation among staff during the stress levels when the uh, like staff are in a panic situation or
Mhm, mhm,
completely
mhm,
panicked and
mhm.
stressed. So how will we care for the patients when we are not mentally strong or when we are in an anxious mode?
So
So that was a
anxiety is one.
common question asked by many of them.
Okay. So basically, what I would say is there will be some anxiety, there will be some fear. So that is the natural human nature of a person because we don't know anything much about this COVID, but things are much improving. We know much more better things. There is more facilities. There's more capacity. We managed to work quite well in this COVID situation. So there is what we, as a healthcare professional, we still have to do the job and we have to face the challenges, but the most important thing is how we risk assess the situation, how we provide support to the staff with education and training, and with improving your competencies to how to protect yourself with hand hygiene, protection equipment. It's not that each and every person who is looked after COVID patients have got positive. It is how some people get more they are more risk of getting COVID patients, but COVID symptoms themselves. But it is about counseling. It is about looking after yourself, looking after your own health when you go home, to do things what is important to you, to be with your friends and family, just even if it's virtually, just to get that support system in place, and not to say that um, I'm suffering on my own. You need to go out and get support, and if you need counseling, there's no shame. There's the amount of stress and the amount of um, uh, untoward situations we have seen. If the staff needs to get help, they need to get help, and this is the way forward. There's no shying in getting help from anybody, and it is about talking and getting and listening and sharing the experiences among other people. So that's the most important thing, I believe.
Yes. Thank you, ma'am.
Thank
There's
you.
one more question. There are also two, three questions of the same type. They want to know that why are we getting infected? The health team is getting infected in spite of using proper PPE. Like even after using them, why are the healthcare team getting infected with the disease?
We really every day we are learning. So we know that is airborne. We know it is transmitted, how it's transmitted, how we can look after ourselves with hand hygiene, protective equipment, gears. But there are some people who are at high risk, but we are not sure exactly how to deal with it. But the most important thing is the policies and procedures, what is in place in that particular play in a hospital. We need to follow that very thoroughly. And even at our home life, people don't. What I'm seeing now is, because the lockdown is down, everybody is walking around the shops with no social distancing. They are going around with no mask or anything. So it's very scary to see that situation. We know that it will happen again, but we want to avoid it. But we can't keep it locked down all the time. We need the economy back. We can't lose this all the working. So it is, there's no, I think as time is passing, we are knowing more about why some people are getting more. But it's about following the policy and procedures, how what is what best we have got, and how to risk assess and how to face the challenges ourselves. Next,
Ma'am,
please,
there's one
Philip.
more question.
Yeah.
Ma'am, there's one more question. One person wanted to ask whether there's any difference in the symptoms between the children and the adults, or is the same?
uh, People, it's not very clear. They are saying is the childrens are not getting as symptomatic as adult, and the adult people are getting more symptoms. But we are not 100% sure if the childrens are the carriers themselves, or they are spreading the infection, but even though they are asymptomatic. So there's lots of research and lots of learning behind this, but it's not very clear how. But definitely the amount of pediatric patients who have come is very, very less, extremely less. I would say it's less than 1% of patients who have children who have been ventilated or tubed. So it's majority of elderly people who have already got respiratory infection. They had asthma, COPD, who suffer from diabetes, hypertension. They are the high risk group rather than children themselves.
Um, Ma'am,
Thank you.
is this one question
No,
also
no, no
that
problem.
uh, yeah, what are the other three main symptoms issued by the WHO regarding
Yeah.
COVID?
So when we started in UK, we were just saying about high fever, cough, which is a new cough, productive cough, shortness of breath. That was the main three things which were we were dealing. But then WHS has and UK itself has said the people who have lost taste of जिन्होंने अपना वो स्मेल नहीं कर पा रहे और टेस्ट नहीं कर पा रहे, तो वो भी एक कोविड के सिम्टम्स में से आया है. लेकिन देयर इज इट्स वेरी डिफिकल्ट इन द सेंस आई हैव लुक्ड आफ्टर पेशेंट्स हु हैव कम विद diarrhea and vomiting, and you won't say they had any other COVID symptoms, but when you test them, because all the patients were coming to A&E and they've been tested and they come as positive, so it's and then now we are finding out that a lot of patients, a lot of staff member who are totally asymptomatic, no symptoms at all. They had antigen testing done, antibody testing done. It's a simple blood test to say if whether you had developed this COVID infection. And including myself, I was not well for 2 days. I felt like it was like a hay fever, but my antigen tested positive. That it shows that I had COVID. So it's extremely difficult. And even the same family, they have got different symptoms. They can. Some people don't have any symptoms. They have some people even with shortness of breath. They can become worse and they can end up in ICUs and things like that. So everybody is different. So the main things we are looking for at the minute is high fever, more than 37 degree, around 38, shortness of breath, um, uh, lose loss of taste and smell. That's the main thing at the minute here.
Okay, ma'am. It's the same thing, like you have answered the next question as well. That is like, can we be asymptomatic after giving care to COVID positive patients? So that is already answered, I
Yes.
think. So we can
Yeah,
also keep
definitely. Yeah. Yeah.
asymptomatic. And one question is, ma'am, like, how do we like deal with the false propaganda related to COVID-19 among the general public?
Yeah, I've seen a lot of things myself as well. So yeah, so there's lots of misinformation, lots of myths around COVID, and especially lot of, I know people are doing it because they don't know about COVID or they are frightened. But as a healthcare professional, we have to be respectful. We have to provide dignity to patients. We have to be we what we are standing for as a value, as why we went into nursing, why we went into medical field. That is more important, whether it's a COVID or not COVID. They are patients, and we are, as a nursing staff, we are there to look after them. That doesn't matter if they have got COVID or. We have to be extra cautious. We have to wear protective gear, but that doesn't mean that you will lose the touch of looking after the patient and be nurse yourself. So that is the most important thing. And going back to the question, what was it specifically asking?
Mainly, like, how will we deal with the false propaganda among
Yeah.
non-medical or general public?
So propagate. There's
How
a lot
will
of
we like,
information. Yeah.
yeah, and how will we actually motivate them, or encourage them or educate them regarding COVID-19?
Yeah.
Because there's so
So
many presumptions regarding this.
yeah. So I think in general public, there need to be more information. There has to be lots of awareness and information, and it's not about what nursing staff it has to be done politically. There has to be more support. There has to be more information about how it's spread, how it's transmitted. So this is not just one person game. It's a team game, and everybody has to work together. And at 5 o'clock every evening, we had prime minister, um, we had all cabinet ministers talking about it, how many deaths we had, how we things are doing, how many swabs are doing, and that helped a lot. And in general, public in UK especially, there was lots of information. They knew about COVID symptoms, how to prevent, and then they stopped. They didn't come to accident emergency for small simple reasons. They managed at home, they looked after themselves at home, and they rang the doctors for help rather than coming to accident. And that's how we manage the hospital. But if each and everybody turns up in a hospital, we will be overwhelmed with things, and so it's difficult. So it's the most important thing is the communication, how you spread the message, how different modes of method of education, methods of training and defense, how the people are feeling themselves. That's the most important thing. And what I believe is, it is through education and communication to general public, that is the most important thing what we need to be done in India.
Okay. Ma'am, this is the last question. I'm sorry, it's
Yeah.
very long
No, no.
list. Ma'am, there's one query regarding there is a talk that it is also a mutant virus. So
Mhm.
is it that as a virus is evolving into a mutant virus, is there that we develop new symptoms? Like what already we have, what we know as such few symptoms, are we going to develop any other new symptoms which we might ignore or are unaware of?
It's very still very early stages. We're not 100% sure if it's mutated yet. There are talks about some people saying
Yes.
that it's different things, but there's no 100% guarantee. So it's different things. Probably in next few months we'll be able to know a bit more about how it is spreading. But we have been able to control it. So it's not, there is always a hope. And few couple of months back we had um, all the wards were COVID positive wards. We had all COVID patients. The trust where I'm working, there is one single patient who's recovered and has gone home yesterday. So, so it's not all negative. So we are seeing positiveness when we are seeing the hope. So it's we will have COVID. I'm not, I'm very doubtful that we will completely be able to eradicate from the world, but it is improving. So that's the main thing. And going back to the question, we don't have much information about if it's already mutated or we'll get a new symptoms. But it depends on our learning, what is the evidence there, and how there will be guidelines which will come, and there will be more information from WH, World Health Organization, and different organizations, how we learn things more. So at the minute, there's no other symptoms. There are asymptomatic people who can be carriers. Yes, I do believe that, but we are not 100% sure if there is going to be new symptoms about those.
Thank you so much, ma'am, for your patience. We have clarified a lot of our questions. Like as the topic says, what we know and what we are learning. We are still learning regarding
Definitely,
this COVID-19.
definitely,
And
definitely.
yes, ma'am. And there's a small announcement. Those who have any queries can email us, and we'll get back to you as early as possible. Thank you, Bindu, ma'am, for your very informative and interesting session. We are very much honored to have you, and thank you so much, ma'am.
Thank you, Sunita. Thank you.
Next, I would like to request Mrs. Sandhya Piyush to moderate the second session. Over to you, Sandhya ma'am.
Good morning, everyone. I'm Mrs. Sandhya Payush, and I'm the Associate Professor in Nursing. And today I'm going to moderate the second session. Not all wounds are visible. This topic will be dealt by Mrs. Reja Abraham, RN, MSc, Medical Surgical, Nephro Euro, BSc, United Kingdom. Moving towards the educational qualification of Madam. Madam has completed BSc Nursing from PD Hinduja National Hospital and Medical Research Center College of Nursing in the year 2011. MSc Nursing from PD Hinduja National Hospital and Medical Research Center College of Nursing in the year 2015. Moving towards the professional experience of Madam. Madam has worked as surgical RN at PD Hinduja National Hospital and Medical Research Center from August 2011 to August 2013, and also worked as nurse educator trainer at A. Maria ILTS Academy from October 2015 to April 2016. And currently, ma'am is working as theatre practitioner at NHS Trust Hospital from July 2016 and to till date. Moving towards the achievement of Madam, Madam has achieved Madam was gold medalist in BSc Nursing in the year 2011 from Maharashtra University of Health Science, and also the best outgoing student in the year 2011 from PD Hinduja National Hospital and Medical Research Center College of Nursing. Certification for overall 8 band score in IELTS from British Council, and also received the recognition as Corona Critical Care Worker by Safeguarding Alliance, Harlow, United Kingdom. Now I would like to invite Mrs. Rija Abraham Pratik for leading the session. Thank you.
Hello and good morning, everyone. Thank you so much for that introduction. It's a pleasure to be here. Firstly, I would like to thank Bethany College, the organizers, and everyone who is behind this webinar. And thank you for this opportunity given to me because this is a very good platform to share my experience, my perspective. So, as the slides load, let me just introduce a little bit about my topic. You know, when you are physically wounded, you can see your wounds. You know, everyone can see your wounds. Others will ask you, oh, what is wrong with you, because they can see what is wrong with you. But how about if you are wounded internally? I'm talking about your mind. When you are mentally not feeling too good inside your head, I'm not saying like mentally ill, but I'm just saying when you feel anxious, when you feel fearful, there is a lot of anxiety and fear which is going around with this pandemic. So my topic, this entire session of today is just a very brief perspective about what is PTSD, that is the post traumatic stress disorder, and how it is going to impact us in this COVID-19 pandemic, and also a retrospective thinking about how this has affected us, how this has affected us, and how in the future PTSD is going to affect the healthcare workers. So first, if we go, next slide, please. So if you see at this particular clip, in this particular slide, you will see a news article, and I'm sure you must have seen hundreds and millions of news articles like this. This is basically from the BBC News, and there one reporter has just explained how nurses and healthcare workers are going through burnout, how they feel anxious, and how they are at a risk, how the entire UK is at a risk of a future mental health crisis. And you in India as well, not only in India or UK, all over the world, we are facing this kind of issues where the frontliners are seeing certain very disturbing things, very disturbing situations, and those memories and those situations stay with you, and how they affect you in your future. This discussion is about that today. Sorry, can we have the next slide, please? So if you see the objectives for today, we are basically going to, the learning outcomes for this entire session is to know a little bit about what is PTSD, how it relates to the COVID-19, how it impacts us as frontline workers, what is the basic symptoms that you would have. You know, these symptoms may not be always very visible, and that's why we are having this discussion. And what are the evidence-based approaches? What is the basic things you can do, what is the things that you can your management can do for you to feel better, for you to have the maximum capacity and the capability to work in this environment, and a very brief introduction about what is moral injury. Next slide, please. Now, going into definition of PTSD, this is a very broad definition, which just relates. It's an anxiety disorder. Now, in Bindu Ma'am's initial session that we had, she had a conversation about how COVID-19 is an anxiety producing issue among the frontliners, the nurses, the doctors, the allied health workers. Everyone is anxious. The entire population is anxious, and we can't blame anyone. You cannot just tell someone, oh, you don't need to be anxious. No, that is not the right thing. This anxiety has to be rightly addressed. And when this is not rightly addressed, when this is not rightly dealt with, it converts and becomes PTSD. So it is rightly said over here that it is an anxiety disorder which is caused by very stressful, frightening, or distressing events. Now you can relate to how PTSD is so relevant in COVID-19 situations. Now, PTSD is not just COVID-19. Actually, there can be a lot of other situations where you can face PTSD. It can be a very traumatic accident that you have seen, or when veterans go to the war, when they fight the war situation and they come back with those memories, and that also compounds the PTSD in people. And taking from there, we have understood, the researchers have understood, people in China, all over the world, WHO, they have undergone and taken a lot of research into ACT, and then they have understood that yes, PTSD is something which can also affect the frontline workers because of the amount of disturbing things that we see day to day. So that was the definition of PTSD. Now, going next to the symptoms of PTSD. Now, again, as I said, it is very difficult to pinpoint at one particular symptom, because we are not talking about a psychiatric illness over here. We are just, in retrospective, we are thinking that this is the kind of situation that the frontline workers had, and then this is how we are going forward with it. So the basic, very common ones that you can see is nightmares and flashbacks. Very common. Now, just imagine you have witnessed a very disturbing scene, scenario in your working hours in the hospital. Don't you think you are going to come back with that memory at home? You're going to think about it when you go to sleep. You're going to think about it. It is very highly possible that you would have a very bad, dream about it. You would wake up crying, sobbing, and you would just, it's difficult. So such kind of things, it is going to come with, it is like a part and parcel, I can say, of the experience that we are having with COVID-19. And the next is isolation, irritability, and guilt. This is again, it is like a complete package. It all comes together with this PTSD. Now, there are also some people who actually do suffer from PTSD, and they are frontline workers as well. Now, just imagine the plight of such people. My heart goes out to them. These people are vulnerable people because they already had PTSD diagnosed. They must be taking some kind of treatment, and now they are a key worker. They are the frontliners, and now they have to witness even more disturbing situations. Now, you can just imagine their dilemma. They would be so disturbed, they would be so upset. So we have to be there for such kind of people, and for everyone, actually. Sorry. So they we may also have people may also have problem sleeping. Insomnia again is a very common symptom that you can see. Now, just imagine that there is a lot of nightmares and flashbacks that you're already having. So going to sleep is out of question. You would just not sleep. You would avoid going to sleep. There would be no proper rest, and that is why it's like running in a circles, like a kind of a situation. Concentration difficulty again goes in hand with the insomnia that we just spoke about. And these symptoms, even though they look like, oh, what is, we can get over it, no, it is not like that, because they have a very significant impact on our day-to-day life. They are going to impact each and every activity that we do, because even a very menial, very small activity or a very small stimuli will suddenly cause an anxiety in us because of what we had gone through. Can we have the next slide, please? So that is why there are certain things which we can do to deal our stress. How so? This session is basically about certain recommendations, which is researcher proof, which is research proof, some which is from personal experience, because I myself was a victim of stress and anxiety, which I had carried it from workplace to home. And I had successfully overcome it just because of my hospital support, my colleague support, friends and family support. And of course, God is there always with us. And with all this very crucial support in life, I was able to overcome the stress and anxiety, and so were my colleagues. So these are just some of the practical recommendations that we can that you can also apply in your life when you are a frontliner. First is self monitoring. Now, when I say self monitoring, we are not talking about the physical symptoms of COVID-19. I would leave that to the other speakers. We are talking about more of the mental symptoms that we could have. Now we are talking about to ask certain questions to you yourself. You need to ask yourself, how am I feeling today? Am I feeling okay? Am I feeling upset? Am I feeling anxious? These are the self monitoring questions that you would ask yourself on a daily basis, and you would need to report when you're feeling excessively depressed. You need to talk to your line manager or your team leader when you see that you're really depressed, you don't want to get up from your bed, you don't want to do anything, and certain small things are producing anxiety in you. So as a frontliner, this will also impact your work. So that's why it is very important to talk about it. The next is regular check-ins with your colleagues, families, and friends. Again, we are not in this alone. We are here to support each other, and that is exactly how we are going to overcome this pandemic. We need to check in on our colleagues. We need to ask them, just the way we were self monitoring ourselves, we need to monitor our colleagues as well. Are you okay, my friend? Do you feel sad? Are you upset? Do you want to talk to me about something? Do you want to cry? Or is there something I can help you with? These kind of statements towards your colleagues is going to make a big, huge difference. And also, as I said, it is not an I team, it is a we team, because we need to work in teams, in partnership with each other, and that is how we're going to get over these issues. And brief relaxation and stress management breaks. Now, you can understand that in your shift, you would have certain periods of breaks. Now, in that period of break, you need to prioritize your bodily functions first, of course, and then you need to take some time off for yourself. It can be like a power nap for 5 to 10 minutes. It can be speaking to your family on WhatsApp or video calling, or just taking a brief moment to pause and reflect what is happening, or just a simple prayer. Anything that works for you, any technique that works for you, you need to do that so that you can control that stress that you're feeling. And also regular peer consultation and supervision. Here is the point where Bindu ma'am had already spoken about compassionate leadership. Here is the point where a compassionate leader, an empathetic leader comes into play, because such kind of a leader can very easily pick those frontline key workers who are facing stress, because not everyone is going to come and tell you that, oh, I'm feeling very stressful. No, not everyone is going to tell that. There are some kind of people who would not say anything but endure this stress, endure this tension, endure this anxiety in silence. And I am here to tell that you don't have to suffer in silence. You have to say, you have to share, you have to speak, you have to ask for help. And as healthcare workers, it is very common phenomena to give help but not ask for help. So here it is very important to ask for help whenever you feel that you are, losing touch. You need to ask for help. And also, as I said, timeouts for bodily care and refreshment. There is, you need to take out times to take care of your own self, of your own body, and that is again going to help you in dealing with stress. Can we have the next slide, please? Regularly seeking out accurate information and mentoring to assist in making decision. Very, very, very important. In the previous session, we already spoke about how misinformation and the lack of information can cause an anxiety, and in fact can cause loads of anxiety in people. So there has to be an authoritative figure here in the UK. The Prime Minister, as Bindu ma'am had already spoken about it, would come out and do a briefing, and he would let us know what is happening. In the same way, in my hospital, we had a dedicated team of members who used to send out daily emails, and there was daily briefing, and they used to let us know what is the state, where we are, and what is the progress that we are making, the good and the bad, the pros and the cons. Everything was explained, everything was crystal clear. There was transparency, and that had helped to minimize the anxieties. And the next point, very important, keeping anxiety conscribed to the actual threat. So we need to keep a check on our anxiety levels. We don't need to be anxious and fearful about each and everything. Very small things or very small stimuli. We don't need to get panicked about each and everything. We need to keep our anxiety level to the actual threat, not to everything that is happening. And also, we need to do our best in maintaining helpful self talks. Your self talks, the way you talk to yourself, is going to enhance not only your confidence but also boost your morale, and also it is going to minimize the anxiety that you would face. And of course, avoid overgeneralizing your fears. Now, why this is important is that small, simple factors might induce a lot of anxiety in you. Now, I can just think of one example over here, which was shared by my colleague about her friend. This is in some other hospital as well. So, this friend of my colleague, she had an episode when she was on work in the critical area, and the clock stopped working. The wall clock stopped working. And that was the time a patient died as well. So henceforth, whenever a clock stopped working in that area, she used to think, oh my god, something is going to happen to a patient, something is going to go wrong. That is called as overgeneralizing your fear. Stopping of the clock is just a very harmless stimuli, but we are making it an anxiety producing stimuli. So uh, we need to just minimize all those harmful stimuli that can be, which is normally there in the environment. We need to just calm down and minimize them. And we need to focus our efforts on what is within our power. We need to understand that, we can't do everything. We can't be everywhere, and we can't do everything. That is in God's hands, right? And so we need to do everything in our power. You need to do everything with sincerity and dedication. Whatever is in your hand, you have to do that and leave the rest. You cannot do everything. That is a point to note over here. And again, acceptance. We need to accept that you cannot change the entire situation, and you alone cannot change the entire situation. So you need to have that acceptance that no matter what you do, some things are they are going to go out of hand, they are going to go unsuccessful. So we need to have that kind of acceptance, and that kind of you need to be readily aware about all these situations. And fostering a spirit of patience, tolerance, and hope. Very important. We need to be hopeful. At the end of this, there is a silver lining to this very dark and gloomy time, which is called as COVID-19 pandemic. There is a silver lining. If you if we have that spirit that this is going to end, everything is going to get back to normal, things will get better, people are recovering, will recover, we will get over this. These kind of talks, these kind of hopeful messages and insights are very important, and that is again going to help minimize the anxieties. Can we have the next slide, please? And at the same time, we should also avoid certain of these statements, which I'm sure you must have had some time or the other in your mind. So what are these? Working too long by themselves without checking in with your colleagues. Again, it happens. And sometimes you really can't blame anyone in this, because there is a staff shortage, there is staff sickness, and there is all kind of situation which makes a frontliner to work for long hours. And usually you shouldn't go very long with the PPE kit. You shouldn't go very long into working in this situation, because again, you're going to harm your own health as well. You need to have proper breaks at the spaced time. You need to check in with your colleagues as well, and you need to work as a team. And working round the clock with very few breaks, again, that is not going to help anyone really. Let us be very practical over here. We are human beings as well. If we were robots, yes, why not? But then we are human beings. We need rest, we need sleep, we need refreshments, we need food. All these things we need to consider. And the third point, if you see, it is a very detrimental point. It is feeling that you're not doing enough. We as nurses, as doctors, as healthcare professionals, there is always this feeling of guilt that, oh, I'm not doing enough, I need to do some more, I need to do some more. That kind of feeling is often carried with more anxiety, that if I don't do more, something is going to happen. No, you are doing everything in your capacity. So if you are working with the entire dedication, with the entire sincerity that you could muster, then you have done enough, and you need to accept that. And you need to stop focusing on the negativity, or stop criticizing yourself or your colleagues or the management. You need to have that kind of positive outlook towards life. And of course, I don't need to mention about the last point at all. Excessive intake of sweet and caffeine, it is not going to help you at all, because you would be jumping around, lots of energy would be there, and that is not going to help you, because then you would have to have frequent loo breaks, and then of course removing that donning and doffing of the PP will be a very big challenge for you. So please avoid the last thing. Just take everything in equal moderation. And as I said, there can be certain in the previous slide, when I was talking about positive self-talks, there can be also self-talks which can be negative. The previous slide, please. Yes, thank you. So there can be certain self-talks which can be detrimental, which can be really negative for yourself. And these are, it will be selfish of me to take time off, to take time to rest. Well, if you yourself don't feel good, if you yourself are not in the sound mind or body, how are you able to take care of your patients? You need to have that rest, and you're not selfish to take a time off, means the break time. Your colleagues understand, we understand, the entire hospital understands, and that is why the hospital will devise a plan where they would give you proper equal spaced out breaks during your entire shift. And others are working around the clock, and so should I. Don't put that unnecessary over pressure on yourself. Try to remain calm, keep your anxiety level low. I know it is very easy for me to say that keep your anxiety level low, but it is very hard when you are in that situation, and having faced that myself, and I can tell you it is possible. You can control your anxiety by small twerks here and there. And the need of survivors are more important than the needs of the carers and the helpers. Well, survivors, of course, the needs of the survivors are important, but you as a carer, as a helper, your needs are also equally important. Please always remember, when you are in a room with a COVID patient, or with any patient for that matter, the second most important person in that room is you yourself. And that's why you need to take care of yourself. You need to be in that position where you are of sound health, of mind, body, and spirit, so that you can take care of that patient 100%. and I can contribute the most by working all the time. Again, it is a myth. You working all the time without taking any breaks, it is going to harm you, and it is going to make you ill even before anything other makes you ill. Again, taking care of your health, taking care of all these things are going to help you in the long run. And the last statement is the most devastating statement: only I can do this. No, you need to understand that this is a team effort, and you as a team are taking care of a set number of patients. So only you can do. No, you need to delegate responsibilities. You need to understand that there is another person who can do the same, and you need to teach them. If you are a very senior nurse, you need to teach your junior nurses. This is the right time to give them the authority so that they can also come up. They can show that they can also do the manage the situation and everything. So these are all the negative self talks that you can do and which can be harmful in the long run. Next slide, please. And this was the previous slides were about how you can deal with your stress during when you are undergoing this pandemic. But how about the ones that you have? How do you deal with the stress after? In the aftermath, after undergoing this COVID-19. Now, I don't say UK is free of COVID-19, but just to say that we have less cases in the particular hospital that I work in, as Bindu ma'am had already spoken about. There is less number of patients who are getting admitted on a daily basis, and we see low mortality right now. So this is what we say as an aftermath. It is not over, but how do you deal your stress in the coming times? Now, in my particular hospital, there's something called as a virtual debrief, where this is a virtual setting. It's just like a Zoom call or a Go meeting call, where all the members, all the frontliners log in. There is a set number of people who can log in, and then we talk. We just talk. We share about our experiences. We share what we have learned. We share about our the trauma that we had faced. We share about the patients that we have lost and how that has affected us. We just talk, and I'm telling you, just by talking, it is going to take off that load from your self, from your mind. It is going to take that load off, and it is going to help you so much in the long run. And that's why seeking out and sharing social support, which may need to occur virtually, and also check in with your colleagues, all these techniques can help you to overcome your anxieties and stresses and fear in the aftermath. And also increasing supervision, consultation, and collegial support. Again, this is the point where a compassionate leadership again is very, very crucial, and that is why Bindu ma'am's session was so important. A compassionate leadership, a compassionate leader is going to understand that how this PTSD, how this stress is going to affect their team members, and what precautions and what suggestions can be taken and can be used, what scientific based approaches can be used, so that these staff members can feel better, and there's more productivity, and there is less sickness in such kind of staff groups. Please be aware, it can be it can go out of proportion. Anyone can be affected with it. We cannot count on our fingers at how many people are going to be affected with it. But as a leader, it is important to supervise such kind of people, the entire staff actually, and we need to supervise ourselves as well. How am I feeling? Just like I spoke about the self-monitoring bit. And also scheduling the time off work for gradual reintegration into personal life, very important when this pandemic is a little bit on a lower side, when things are looking better, when the hospital is looking better, and then you can just gradually schedule some time off, which can give you some time to take care of yourself and get back to your personal life as well. Next slide, please. And there are also, when we talk about coping strategies, which we spoke about in the last slides, there can be positive, and of course there can be negative. So now we are talking about the negative coping strategies. So use of alcohol and illicit drugs and prescription overdosing of prescriptive drugs, this is never a good idea. Why? Because this is going to not only delay your recovery time, but it is going to hamper your attention, it is going to hamper your thinking, and it is going to affect you not only for a short span but in the long run. So using them is never a good idea. But please be aware that if you use any of these substances and then it becomes like an addiction, and then it becomes like a problem. So if you have this kind of issues, please, there is help available. And this also includes smoking as well. So there is help available. So use all those help which is available virtually, on the phone, anywhere. Just be aware that there is help available. And then suddenly making very big life changing decisions. You've just been you've been in that pandemic situation, you are a key worker, you come back to your residence, and then you take a very big decision like, okay, I'm going to get married tomorrow, or I'm going to move into a new home tomorrow. These are very big life decisions because they come with a set of anxieties on themselves. So if you have already been in an anxiety producing situation in the past, and you're going into an anxiety producing situation in the future, these two anxiety would compound your effect, and you're going to be you're going to have a full blown anxiety attack. So that's why, just take a step back, take one thing at a time. There's no rush. Nothing in this life is a rush. Just take a deep breath, just calm down, take a pause, and just think that, is this the right time to make that very big life changing decision? Can it wait for some time? I need to focus on myself. I need to retrospect on what I had undergone in the last few days or weeks or months, and then I need to process those feelings, those anxieties first, and then I can go into something new. Please understand the difference between the past and the future. You don't need to carry all the things that was there in the past. You don't need to carry that in the future. You need to process those feelings and then start with a new chapter when you go ahead. And negatively assessing the work contribution, very common among the healthcare workers, where we always think, oh, I could have done this, oh, I should have done that. Negative criticism would never actually work well. You can, of course, if you use that in a positive way to better yourself, to think that, okay, I need to work on this categories, I need to work on this strategy for my future. If you are preparing yourself, if that is a way you plan your things, that is okay. But always negatively thinking that, oh, I'm not well enough, I'm not good enough, I'm not worthy enough, these kind of talks can only be detrimental to your coping strategies. And keeping too busy. You already were in that pandemic situation where you've faced a lot of disturbing situations, like death of patients, that continuous influx of patients, and then you're not processing those feelings. Rather, you're trying to be busy in something else. That is not going to help again. You need to process all those feelings. You need to process all that things that happen to you, and then you need to go ahead from there. And also viewing as helping others as more important than self-care. Well, there is always this altruistic feeling that, I'm going to think, I'm going to be the bigger person, I'm going to help others. You can be of a big help if you help yourself first. Your self-care, your health, your mental health matters as well. Others matters, definitely others matters. But if you are in your as I previously said, if you are in your 100% physically, mentally, you will be there available 100% to help the other person as well. So please bear that in mind as well. And not wanting to talk about your experiences, again, there are, you cannot actually force everyone to talk about it. So you cannot be like, oh, tell me what happened, tell me what happened. There are some people, there are some introverts out here in the world who process these feelings and anxieties at their own pace, at their own level. You cannot force them to come out and speak to you. So not wanting to talk is sometimes, I'm talking about how it can negatively affect you. You need to talk, you need to share, you need to vent out, or sometimes just have a nice good cry about it. That is going to help you as well. And as I said, that can be different for the introverts because they don't actually want to talk about it. They have a different way of channelizing their fears and analyzing all the memories that they had. So removing them from that last topic. But if you can talk, please come out, talk, vent out your feelings, just share your experiences, and this is going to help you as well. Next slide, please. Now, as I said, if you remember, the last objective is about moral injury. Now, what is moral injury? It sounds very fancy. It sounds like it's just it has come out now in the COVID-19 crisis. But believe me, this has always been there because clinicians, consultants always face this kind of situation. Now, moral injury stems from war veterans, people who have been to the war, who have seen very disturbing, encounters like killing of innocent people, bombings, and in that bombings, killing of those innocent people, and how they were unable to save those innocent lives, and that feeling of guilt and fear and self-loath in those war veterans. From there, we have understood the feeling of and the concept of moral injury. And now we are going to talk about how moral injury is becoming more and more apt in this COVID-19 situation. So basically, this pandemic, the scale of the COVID-19 pandemic is huge. It is affecting worldwide, and it is affecting the healthcare very drastically, because if you see the influx of patients with COVID-19 coming to the hospital is huge. It is high, and that is why government has put these policies and protocols of social distancing, wearing the mask and everything, because to reduce that influx of patients to the hospital, because huge number of patients coming to the hospital is not equipped with to cater to needs of all those patients. They can only cater to the needs of a set number of patients. When you overwhelm the healthcare system, it is going to affect very badly, and that is where you run out of hospital beds, and situations go bad. We have seen this already in Italy, and there were situations here in the UK as well. But now things are getting better. Things have changed. So COVID-19 is placing a very significant demand in an already stretched healthcare system. Now, the next point is prioritization of resources. We're talking about staffs, beds, and ventilators. Because of that increase in demand, there was already a demand, and now because of that increase in demand, it means that some patients may not receive it. Okay, please understand this. Like, what the example that I can give over here is, just imagine there is one ICU bed in a particular setting. There is just one ICU bed. You have two patients coming to you. One is a 70-year-old with the same COVID-19 symptoms, and one is a 20-year-old with the same COVID-19 symptoms. Both of them coming for the same hospital bed, for the same ICU bed. Now, just imagine the kind of plight that clinician would be when making that decision, and the plight that you would be in as a frontliner when you are assisting that clinician in making that decision, in sharing that decision, in being in that room where you deny that 70-year-old man and give that bed to the 20-year-old man. Because you just imagine, that is what is the meaning of moral injury. You morally know that this doesn't feel right, but you have to do it because of this pandemic. You are not a bad person. You're not taking a wrong decision. It is just that the kind of situation that we are in right now. And when preventable loss of life occurs due to all these reasons, healthcare workers may be at a huge risk of moral injury. And you see, this moral injury is going to stem to that PTSD, and it is going to compound that anxieties. And that is why moral injury and PTSD both go together hand in hand. And that is why it is important to identify, to diagnose, and to understand that, okay, this exists. It is there, and we need to give direction to it. We need to have certain things in place so that we can take care of people who are distressing about these kind of symptoms of moral injury. Next slide, please. So if you ask for a definition, what do you mean by moral injury? It is defined as a psychological distress. You see, this distress is always there. It is going to be there with you because of the, just remember the example that I just gave you. It is defined as the psychological distress which results from actions or the lack of them. You know what you need to do, but you're unable to do it because of the COVID-19. You're unable to do it because of the constraints of the resources, because you have to prioritize who gets it, who doesn't get it. So that is the thing, and which violates your moral and ethical code, and that is going to cause a lot of distress. Morally, it is going to cause a lot of distress to you. And this moral injury is also because of these difficult decisions that people have to make. There are certain clinicians who have to make these kind of decision, and it is so hard for them to make these decision, and it is so hard for us to share this decision. You feel bad, you feel to cry out, but these are things that you have to do. And also moral injury can also be caused by very high mortality rate. You think in a given day there might be a huge number of mortality rate in your particular hospital, in your particular area, and you feel morally distressed about it because you need to take care of other patients as well. And there is a dying patient, and you cannot allow the family to meet that patient in that particular dying time. That patient has to go away alone, and all these kind of scenarios and scenes, they also stem out this concept of moral injury. And also moral and ethical dilemmas, as I spoke about, all these things can compound the effect, and it can cause a lot of issues and problems as well. So there are certain practical recommendations that is there. It is researcher proof recommendation. Can we have the next slide, please? Thank you. So we need to just prepare our healthcare workers. We the again, compassionate leadership plays an immense role in this. There has to be a dedicated leader for this, who has to basically, frankly, just prepare us as key workers. They need to prepare us that this is the fact, this is going to happen, and we need to be prepared about it. But we are here for you. There has to be a very strong support there behind such clinicians, such nurses, such allied healthcare workers, so that they don't feel that distress, so that they don't have to feel that distress. They don't have to be that victim that we have done something wrong. They don't need to feel morally low because of the decisions, or the decisions that they have made in the future or in the past. So we need to be frankly prepared about these all situations that we need to face. Also, none of the challenges need to be sugar coated. It has to be hard facts that this is the thing that is going to happen. There is no way a sugar coating a difficult situation is going to make it better for someone else. The facts need to be said. It needs to be discussed, and it has to be leader-led discussion. It has to be a discussion where people are able to understand that there is someone to support them, someone to take care of when decision like these are made. There's a legal support available, there is non-legal support available, there is psychological support available. Very, very important, because all these things, when they are in place, the distress that the person feels is going to be minimal. And we are going to help a lot of clinicians by doing these small practical things in a hospital setting. And again, as I said, an empathetic leader is going to make a vast difference in a person who is going to be suffering from moral injury. An empathetic leader is going to make sure that the staff, that the team that they are leading, they don't have or they have the minimal effects, or they are not the 100% victim of the moral injury. And of course, family and peer support is also going to help and make a huge difference over here. Because just imagine a clinician made that decision to give that bed to that 20-year-old COVID positive patient, and not to that 70-year-old. And that 70-year-old patient, of course, later on dies. Just imagine that clinician's psychological health. Just imagine the mental health that he would be having, that the thoughts that he would be having, that moral distress that he would be having. Now imagine this clinician supported by the peer, the family, the hospital, the leaders, such a clinician who is supported, and when the decision is shared, and each one is transparent about the decision making process. There is transparency and everyone is aware what is happening. Such kind of situations, such kind of interventions are going to help minimize the moral distress in people. And if PMIE basically stands for the potentially morally injurious experiences that people face, and if it occurs in the similar processes to those described, PTSD briefs may be followed. Same interventions that we spoke about in the PTSD interventions, you can use the same interventions to in a moral distress situation as well, and you can use them to overcome this kind of very difficult situations. But if at all you continue to feel distressed, morally distressed about this, about the decisions that you're taking, about the decisions that you have taken in the past, and you feel bad about it, you just don't feel right about it, there is always help available, and you need to reach out and ask for help. And there is always professional help, psychological help, which will always be available. So these are the basic techniques or the suggestions or the interventions that you can use. So this was just a very brief talk about how PTSD and how moral injury and these as a group in a compound effect can affect a key line worker. And as frontliners, each day as you're facing very disturbing things, you will take a part of it and bring it back home. I'm talking about the memory part, not the infection part. So you will bring back some of those thoughts back home. But all I need to tell you, your take home message right now is that there is help available. You are not alone in this. It is a team effort, and you and me together, we as a team can do this. So we need to be there for each other, take care of each other, and only through this constant help, support, and empathetic leadership, compassionate leadership, we can minimize the effects of PTSD in us, in the key line workers. And also in the next slide you will see certain references that I have put up. These are references that you can use for further reading, for further study. You can use these references, and I hope that this becomes a session which is fruitful for you, and you're able to manage stress at your workplace and in your personal life as well. And any questions anyone has about the session that we had?
Thank you, ma'am, for the wonderful session. There are
Thank you
some
so
of
much.
the questions which is asked by the viewers.
Yeah.
So the first question is, PTSD is common in medical as well as in the common public. So how to manage in the common public?
Yes, of course. PTSD, as I mentioned briefly in my talk, it is seen in everyone. It is not just healthcare workers. It is seen in, for example, if there is a woman who had a very traumatic childbirth, that trauma can also, that traumatic childbirth that she had, that is also going to lead to PTSD. So it is just not healthcare workers, it is a common man as well. Anyone can have that. So these practical recommendations that I had spoken about earlier, like self-monitoring, talking to yourself, sharing, asking for help, this is applicable not only to key workers but also to the general public as well. So whenever you feel that you're feeling overwhelmed, there is too much to process, you cannot deal with the stresses and the anxieties that you're having, reach out for help, to ask for help, talk to people. There'll be definitely help available. I hope that answers your question.
Thank you, ma'am. Next question is, are the societal cases also a sign of PTSD?
Well, I think this question stems from the recent celebrity death that we had in India. Yes, unfortunately, there is a connection between PTSD, depression, and suicidal rates. Because it is not identified, it is not diagnosed, and basically it is not spoken about. And that is why I am again and again reinforcing that you need to talk about it, because if you don't talk about it, there would be no actions about it. So if you talk about it, right actions will be taken, right people will be involved, and then there would be a less rate of mortality in cases of suicides and everything. So there is always help available. There's loads of helplines now in India where you can dial in. Here in the UK, there is NHS 111, which you can call and you can ask for help. There is suicide helplines, there is the Good Samaritan helplines. There's loads of helplines available. If you don't want to talk with someone whom you know, you can anytime talk to someone whom you don't know. Just pick up the call, just dial that number and just speak. And you would trust me, just by speaking and just by sharing what you are feeling, your anxieties, there would be a change that you would feel internally. So I hope that answers the question.
Thank you, ma'am. Next question: how we can understand that a person is suffering from silence if they are not sharing?
Sorry, I didn't get that.
How we can understand a person is suffering in silence?
Suffering in silence.
Suffering in silence.
Okay,
Yes.
okay, yes. Yeah, that's what I said. If you remember in my session, and I think in the fourth or fifth slide, I was saying that some people will not talk about it at all. I was also referring to introverts as well. Some people will just suffer in silence. They go into this automatic robotic mode where they just come to work and they just go back home. They don't talk about anything. They don't share about anything. And team leaders need to be very vigilant about such kind of individuals, because each team has such kind of individual. Not everyone wants to talk, not everyone wants to share. Some people do suffer in silence, and I want to speak to those people who think that suffering in silence is all right. No, it is not all right. If you feel that you are not comfortable speaking to your team leader, find someone whom you can speak. Just as I spoke about that helpline, that is an unknown person. You don't even know that person. You don't need to think, what will that person think about me? You can just pick up the phone, just dial that number, and just talk away, and just give out that information. And sometimes you would also find some people who would not prefer doing that as well, but there would be some physical signs. There'll be physical features that you can see, and you can identify that, oh, something is wrong with that person. Excessive silence, looking very depressed, not very unkempt appearance, not taking any efforts in doing anything. Such kind of person has that PTSD part is over and slowly progressing towards depression. So such kind of people, just by the physical appearance and the physical things, what you can see and you can identify such kind of people who believe in silence. I hope
One
that
last question,
answers.
ma'am.
Yes.
How to remove stigma among the people
Yes, there
regarding
is a lot of
COVID-19?
regarding COVID-19 or regarding the PTSD.
PTSD.
Yeah, so yeah, there is immense stigma. Like, if someone says that, I'm not able to cope with it, I'm not doing okay, I'm feeling upset, I can't do it, and such kind of talks, if person A is making, there is always a person B who says, oh, too much. Why she has so much of trouble, why she has so much of issues, why she is talking something like that. No, you can't talk like that. A person's coping strategy is just like pain. The pain I feel and the pain you feel, it is different. You can't say that you feel the same pain that I feel. In the same way, you can't do the same thing with anxiety as well. My anxiety level and your anxiety level are two different things, and the way we cope with this, it is two different things. So there is a lot of stigma which is there regarding PTSD. Like, if I talk about it, what will people think? What will be my competency level? Will people trust me with certain type of activities? What will my superior think? What will my management think? No, you need to stop having those negative self talks, because if you need help, there is help available. And if you talk, that stigma will come out, because when one person talks, there will be another person joining in, then another person joining in, and in a chain reaction, a lot of people will come out and say, yes, we were having this problem. And that way, you alone would have solved the problem of suffering in silence. So you alone talking is going to resolve a lot of issues, and you alone are going to resolve that stigma issue. So yes, talk about it, vent it out, share with people. That is going to remove that stigma. And not only talking about it, it needs to be in the media. And you can already see the social media is buzzing with mental health issues, the campaigns about mental health issues. So when we see it, when we hear about it, when we see it, we are going to be more aware about it. And nothing like education, and that is why we have this webinar where we are talking about these things. Even though it is in retrospect, we are talking about it, and we are learning from the things that we have undergone. When we learn about it, there is less stigma. Only education can remove such kind of stigma and negative things. So I would say education and talking about it.
Thank you, madam. Thank you for the wonderful session, and we were much honored to have you for this webinar. Thank you once again.
Thank you. Thank you so much for having me. It was really a pleasure to be here. And thank you for all the questions from the participants. I hope that this was a very, even if I know I spoke a lot, but if you can take the key messages home, I hope my work over here is done. So please continue to support each other, take care of each other, be with each other, speak about it, and, educate about it, and create awareness about it. And thank you so much for having me over. It's a pleasure. Thank you.
Uh, Thank you, Mrs. Raja Abraham Pratik. It was really a wonderful session. Now, moving further for the third session, I would like to hand over this to Miss Yogita Nagvanshi. Very sorry for that, Miss Yogita Nagvanshi, to moderate our third session. Over to you, Yogita.
Good morning to everyone. I'm Ms. Yogita Nagvanshi, Assistant Professor from Community Health Nursing Department, Bethany College of Nursing. Today I will be moderating the session third, that is Overcoming Quarantine Blue. I'm happy to introduce the speaker, Mrs. Shilpa Pushpan, RN, MSc, BSc, Medical Surgical Nurse, Kingdom of Bahrain. Moving forward to educational qualification, Madam has done BSc Nursing and MSc Nursing from PG College of Nursing, Cancer Hospital and Research Institute, Gwalior. Next slide. Next, moving to the professional experience, ma'am has worked as a clinical instructor in PG College of Nursing, Cancer Hospital and Research Institute, Gwalior for 2 years, and as a lecturer in Academic of Nursing and Health Sciences, Bhopal for 2 years. Currently, ma'am as a working medical surgical nurse, in Kingdom of Bahrain. Ma'am has been awarded with the Best Outgoing Student of 14th batch in 2009, University rank holder in year 2009, elected as MP State as the VP for the year 2006, presented many national and international papers in various conferences. Now I welcome Madam to lead the session.
Um,
Yes, ma'am.
Thank you, Yogita. Thank you for the introduction. Very good morning to all of you. I hope all of you are doing good. I would like to take this opportunity to thank Bethany College of Nursing and all the esteemed personalities associated with this for giving me the pleasure to address this audience and to express my views on the topic overcoming quarantine blues. But before proceeding, let me just confess, I am profoundly proud to be a part of a profession who has some very intelligent, caring, strong, dedicated, and devoted nurses who can go to any extent to take care of their patients when they are in need. These days, there's a generalized fear among the healthcare workers regarding their safety and their health. Uh, I mean, it's globally around there right now. Even if you let's step down to the streets or you visit a grocery shop, I mean, you can very well attest the worried glances or intentional spacing or a hurried demure. But this fear is actually greater for the nurses or the healthcare professionals who um, possibly have a higher chance of getting unknowingly contracting COVID-19 and passing it on to their colleagues, to their patients, to their family members, or maybe to the community people during the essential eras. Can I have the next slide, please? Yeah, the International Council of Nurses highlighted the increased anxiety and stress for nursing staff who comes out to be COVID-19 and kept on self-isolation and in quarantine in countries around the world. The next slide, please. There was a study which was published in the Lancet Health Journal on the nurses who were in actually in contact with the patients who were susceptible SARS cases. So it shows that by the end the quarantine period ended, that was like 14 days. Being in quarantine itself was the most predictive factor of the acute stress disorder. I mean, the nurses who were in the contact with the SARS patient showed many negative psychological responses, such as over 20% reported fear, 18% reported nervousness, 18% reported sadness, and 10% of them reported guilt. Many qualitative studies were also done, which were identified the range of psychological responses to quarantine, and like such as confusion, fear, anger, grief, numbness, and anxiety-induced insomnia. Next slide, please. So this session is actually about my experience during my quarantine, the stresses I went through during the quarantine and post-quarantine, and how I overcome my quarantine blues. Well, I'm sure like around COVID around, we are very familiar with the term what quarantine means. But let me be very frank, guys. Being in quarantine or self-isolation or living in a fear that you may be tested as COVID positive is a situation which takes us to a completely different level. So as it was mentioned that I'm a medical surgical nurse, so being around with sick people each day, I had my fair chance of getting exposed to this deadly virus. So the thing like it was an off day, sitting at home having fun with my family, like after a 3 consecutive morning tiring shifts. So I was having fun at home, like having all these normal things. I got a call stating that I'm one of the primary contact of a COVID positive patient. And I need to be in isolation along with my 5 colleagues. I need to be in isolation and on self quarantine to monitor my symptoms. At that moment of time, I mean, a lot of thoughts floated into my mind. I started recollecting the 3 morning shifts I had. I mean, each and every step I took in that 12-hour shifts. Whether I was wondering whether whether I was wearing the PPE properly. Did I do my doffing properly? Was the hand washing proper? Was any of my patients or colleagues showed any symptoms related to COVID? I mean, as I told you, I'm working in a medical surgical department. There is no COVID patients, but you never know. The one who's walking beyond besides you can come out as COVID positive at that time. So it was like, but more than all this, there was a guilt within me that like I could have played a little more safer to avoid the situation. See, I came into nursing because I wanted to be a nurse. But at that particular point of time, I felt that, oh God, did I take a wrong decision? I mean, uh, is nursing my cup of tea? Like I went into that thought. Even more petrifying, it was like I had a thought that my husband or my kids will get infected because of me. Sorry, there was a fear within me. I mean, a fear ran down me, a fear that the stories which I'm hearing throughout the world, will that be my story? I mean, it was a very difficult situation. So finally, we decided to be on self isolation. Um, and trust me, guys, self isolation isn't easy when you have two super kids living in, and you're living in a single room apartment with a hall and a washroom. It was terrible for my husband and myself. We had a very tough time. So I decided to stay back in my bedroom. Rest of my family, my kids and my husband, they stayed in the hall. I had a corner right outside my room with all the necessary personal things which I wanted, like disposable papers, disposable paper plates, and a lot of things which I kept handy. I made sure that each and every time I went to the washroom, I disinfected it right away and asked my family to wait for like next 30 minutes before using it just to keep them safe. I went into an OCD condition, to be very honest, like, constantly cleaning and disinfecting things, like the high touch areas, like the doorknobs, the slabs and everything. I made sure the kitchen was clean because there's no one else to cook. My husband doesn't know to cook, so it was always me. So, like constantly cleaning and disinfecting the kitchen, restricting others from entering it. Apart from all this thing, I mean, I had one thing constantly in my mind: what is going to happen next? What is my plan? Like, how I'm going to help my family? Will I be tested positive? Will I start showing any symptoms? Will the symptoms get severe? I mean, all these things were eating my head like anything. I mean, I was frustrated. You can say fear, anxiety, nervousness, guilt, anger, frustration, anxiety induced insomnia, you name it, and I had each one of it, to an extent that surprisingly I started showing symptoms without being turning COVID positive. I started showing fever. I had 38, 38.1 with, I mean, for no reason. I developed sore throat. I had cough. I had body ache, back pain, and everything which was resembling that I can be or I may be a COVID positive case. Uh, at that particular moment of time, I realized how badly our health affects our physical health. I mean, how greatly they are correlated. I mean, you have to be strong here to be stronger here, otherwise it really won't work. So every individual, they have different level of stress, or they have different stresses, and they deal it in a different way. So next slide, please. So I'll just enumerate few stresses which I went through while I was in quarantine. The duration of the quarantine. The duration of the quarantine, in the sense that I was in quarantine for 9 days. Thankfully, by God's grace, I tested negative and I came off. But I was constantly wondering, what if I came out positive? Like, if it will be positive, I have to elongate the duration, and I have to go through the whole thing again, the same thing. I have to go for a longer period of time. And there are studies which states that, like, if the quarantine periods exceeds more than 10 days, the risk of anxiety, the risk of stress is more. So, like anything beyond 10 days actually can cause post-traumatic stress disorder, as Rija mentioned. The second was the fear of infection. Yes, I was constantly in fear that I should not be the one. Okay, fine. If I'm positive, it's okay, but I should not be the one infecting my kids and my husband. I mean, I was really worried about that. So, as I told you, I had this OCD condition, like cleaning and disinfecting each and everything. So that fear was inside me. Frustration and boredom, like being in confinement, like without any social or physical touch, being away from your family, although we were staying in the same home, but a door apart, so it was quite difficult for me. When I was locked in my room, when I could hear my kids screaming or crying their heart out, I mean, that was the worst thing one can face. during this quarantine. Like you cannot hug your kids. That was so difficult for me. So that the frustration of boredom, like you cannot do anything, you can't go out, your normal routine is all misplaced. I mean, you're stuck in a place. That's horrible. Next is inadequate supplies. Although inadequate supplies, well, for me, the quarantine was called all of a sudden. I mean, we were not prepared for it, but by God's grace, we had, the stuff for the next 7 days or so. So we were ready. But I have heard stories of like my colleagues and and many of the families here, like they don't have anything to eat and drink, and they cannot go out and get the stuff. So it was a terrible situation which they faced. Inadequate information. The social media is bombarded with all kinds of information regarding COVID, the do's, the don'ts, but most of them are rumors. So we need to, like, when there's an inadequate information, and when you listen to all those things, your stress level actually increases. You get more frustrated, you get more hopeless, and you get more upset, thinking that okay, this is going to happen. Probably that is not the thing. But then again, because you don't have a proper information, things get haphazard, and it will be very difficult for you. Next slide, please. Stresses post quarantine. So those were the stresses which I generally faced, or maybe it's most likely like everyone who's on quarantine will face. But then stresses post quarantine. To be honest, thankfully I didn't went through this, but I just mentioned it just because this is most likely that everyone go through. First is the financial thing. When you're in quarantine, you are not allowed to work for like few days or like few months. Probably you will, even if you turn COVID positive, there are situations in Kingdom of Bahrain. I have seen many people, if you turn positive, you're out of your job. I mean, you lose your job. And that's a stressful situation. I mean, you're not prepared. You don't have any financial backup. You don't have anything else to support you, and all of a sudden you lost your job. So that actually increases the stress, and that has actually caused to increase many suicidal rates also. Stigma. Second is stigma. There's a lot of stigma around regarding COVID-19. I mean, you cough, and you will get a weird look from everyone that something is wrong with this guy or with this girl. So that's it. So I mean, thankfully, by God's grace, I didn't face the stigma, because I have a very good group of friends and colleagues around me. My family was quite supportive. But there are a lot of people who has faced stigmatization, rejection, a kind of suspicion and fear. People don't try to bring them around when they think that these particular people were quarantined. Even after tested negative, they are treated like that. Next slide, please. So there are certain ways, I mean, in which you can actually combat the quarantine blues. I mean, to bring back that sanity and happiness back to you when you're in quarantine. I know it's a difficult thing, but then again, there are certain steps which we have to take to keep ourselves sane, to keep our mental health intact. Exercise is one of it. I know you don't want to hear that from me, but trust me, guys, exercise, I'm loving it. And exercise actually releases the endomorphins, and it brings the positivity in you. And that's the most of the important thing which we need right now, the positivity, the feeling of optimism. Yes, we can overcome this. We can overcome this easily. That is a thought which we need the most right now. Next is maintain a regular sleep schedule. Yes, that's a very important thing, because if you're sleep deprived, your stress and anxiety will increase. I myself has faced this thing, like anxiety-induced insomnia. I couldn't sleep throughout the night when I was in quarantine. I mean, the constant worry of being tested positive was there. So, but I made sure that I had a proper time, like proper sleeping time and a proper waking time, so that I have a peace of mind. Stay connected with family and friends. Zoom calls are the new norm. I mean, just a finger touch and you are with your near ones. Like as mentioned by Rija and Bindu ma'am, you should speak about it. You should talk about it. You should ventilate your thoughts. I mean, nothing more can help you other than this. I mean, there's no need. in suffering in silence. You cannot help you. It will not help you in any way. So talk to your friends, talk to the people who are going through the same situation. It will bring in a sense of community and empowerment. It will help you to just remove your. I mean, the boredom will go off. That's true, but then again, it will help you to strengthen yourself more. Avoided social media and news. Yes, you know. Information is important. To be informed is important, but overwhelming with the information actually is not going to help you. So, like when you're in quarantine, when you're in such a stressful situation, try avoid. Yeah, you need news to update yourself about what's happening around the world. I mean, what's the situation of COVID? But then again, social media is, as I told, it's full of all the news from everywhere. The truth, the false, everything is together. So you never know what is the right thing. So better to avoid those things for a certain time, or maybe you can keep a time for it. Like at this particular 30 minutes, I'll just have a so go through all the social media thing, and then that's off. That's it, because that will help you. Because more and more you will get into this, you will be more stressful. Your fear, your frustration, your anxiety will increase more. Healthy diet. Well, I'm a very good diet person, healthy person. So, eating, even if you're in quarantine, even if you're bored of your life, even eat, eat, you will feel better. It goes directly, to your stomach, but the reaction will come to your heart and your mind. So it's always good to eat better, eat healthy food. I mean, avoid caffeine, avoid lots of chocolates. I know it's a difficult thing, but then again, that actually increases your stress level more. Sticking to a schedule, that will help you in a lot of way, because you're out of our normal routine. We are out of what we are generally doing. It's not normal for us. It's something which we never predicted, that this kind of a situation will come into such a situation. So because you're not going to your work, you're not meeting your friends, you're not sending your kids to the school. uh, Everything is affecting you in a very bad way. So keep a schedule of whatever, even if you're in quarantine. Keep a schedule that you will do this particular time, this thing in this particular time. You'll wake up at this time. You do your reading, your cleaning, your washing. I mean, that actually can help you in a better way. Yes. Next slide, please. Okay. Hearing all this, like all the 3 sessions, now you will be thinking, who in their right mind would want to become a nurse after all these things? I mean, I'm sure many of you are thinking the same, and it's a reasonable question to ask. So, what I think is that the nursing students who are graduating at this particular period of time are in a unique position of actually visualizing, or actually getting to know many things which they were unaware of. Next slide, please. I'm glad that the nursing students, they will actually understand the power of nursing. I'm glad you get to see how the profession you are entering into is actually responds to how well they respond to a crisis like this. How nurses are working together. Your soon to be colleagues are working together for themselves, for the nurses, for the colleagues, and also for this country. You will be happy to know that how these nurses are educating their public, and how the nurses are lifting each other up with like new innovations each day, and with evidence-based practices and everything. Mm, to be honest, these are like very normal things. I mean, we do these things like the innovation, evidence-based practice, boosting the morale of each other. These are the things which we know, but I'm happy and glad that this is open to a larger display for the public, so that they can actually get aware of the strength and the power of the nursing. That nursing is not just a profession of taking a syringe and going to put an injection. No, it is not. Nursing is beyond and much more than that. So I'm very glad that we have a set of nurses who are eager to join us, eager to come to our side. And let me assure you guys, like uh, even in this crisis and overwhelming situation, you are ready to step up, and we are here to help you out. And there is no doubt in that. Just try to listen what your teachers are teaching you. Just be concentrate on everything which are being taught. Just try to learn more and more. Try to advance practically. Don't ever fear to learn anything new. I mean, please go ahead. If you don't know anything, ask, and that is the only way that can help you, because that will increase your knowledge, that will increase your practical knowledge, and you will be smart enough to handle any situation. Slide change, please. So that's it. Definitely, you're all going to be an amazing nurse. I mean, there's no doubt, there's no fear. Although it's a COVID situation, this we will overcome this. I mean, this is not for forever. I mean, this will we will come out of this, and I'm sure each one of you will come out as bright nurses who will be the asset to the nation and to the public around. Next slide, please. So I'll just end up my session with an important message to all of you. Consider your stress as a shelf onto which you keep your books. So you'll keep one book. I mean, it's okay. You'll 2 books, 3 books, 4 books. The shelf is actually bearing the weight just fine. I mean, there is no issue in that. Then comes 5 books, 6 books, 7 books. The shelf will start sagging. You will see the shelf will start sagging, and you will not notice that. I mean, you will not find it as important, and you keep on adding more and more books to a level that the shelf will actually break and the books will tumble down. This is the somewhat same with our stress level. This is very similar to our stress level. We and the factors involved in our life, that add up to our stress to a level that we sag our shelf, and finally there's a breakdown. So know your stress signs, and if you're not sure, ask someone who knows to help. Just the moment, like the way, if you'll ask someone, definitely there's going to be help coming your way. So identify your stress level. If there's some indicators that your stress level is popping up, that's a sign that your shelf has to be stable and you have to do something to avoid sagging. That's a realization which only you can do, which only you can understand, that there's something I need, there's some help, that's some help that I want in my way. So understand your stress level before a breakdown, and work hard to be a good nurse. Thank you so much. If you have any questions or queries, happy enough to answer them.
Yes, ma'am. We have questions.
Hi,
Ma'am,
Yogita. Yes.
yes, ma'am. Ma'am, one attendee has asking question. Do you
Yeah.
still think that you have taken a wrong decision by choosing this profession, as you said in the starting of the session? There's a question.
No, I'm a human being, so everyone goes through the same thing, right? When I faced this situation, I really felt, yeah, why am I in this profession? Why did I choose that? But nursing is a calling. You come because you are already assigned that you are going to be a nurse, and that's a calling. And when that comes out, I mean, these are the part and parcels of a life. This comes and goes, but the nurse within you will stay forever. And no, I didn't take a wrong decision at all. I am an adamant nurse. I want to be a good nurse, and I'll continue to progress in this.
Okay, ma'am. Ma'am, second question is perspective on the future of nursing post COVID-19.
Yeah, like I foresee post-COVID nursing. Actually, it can be one of the two primary trajectories. Like either there can be an exacerbation of shortage of nurses, which we already have, or there can be influx of nursing. There will be a lot of nurses coming into it. Why did I say that? The exacerbation of shortage, because of the fear, like the bedside nursing, because of the fear of contracting COVID-19 and passing it on to the family, or because of the insecurity of their health. So that's the kind of fear generally everyone have, and that can cause the exacerbation of shortage of nursing. And the next one, as I mentioned, maybe there can be increased influx of nurses. That can be because you can see that now all over the world the nurses are applauded. So that's a kind of motivation to come and work and help others and to join into something which you want, which everyone is doing. And now you can see the job opportunities are quite higher. The salaries are very good. Plus, it's not only the bedside nursing which is there. We have telenursing, we have nurse educators. So the nursing students or the nursing graduates can actually go into that stream also. So they will probably select whatever they want. And you know what? one thing is very clear. Like, if you want to be in this profession, in which you can see that that has a history of like so many wonderful things happening, you will stay in this profession. But to to say what is the exact thing, like whether it will be a shortage or whether there will be a good number of nurses, I'm like, I can hold my breath right now, because I'm not very sure about it. We have to wait for the next couple of years to actually witness it.
Okay. One more question. How to develop resilience that would help to move ahead?
I didn't get you. How to?
How to develop resilience that would help to move ahead?
Oh, resilience is something which comes within us. It's like, it's how well you endure to things that's happening around you. You have to be like, your personality, how strong you are, like it's always inside you, the how you want to deal with the situations. That will actually help you to cope up such situations. If you are like, if you have a mental capacity or a mental strength which is not ready to cope up with such situation, probably you won't be. Maybe you need some more help or support from others. But like, if you're strong enough, if you have a strong personality, I think it will be easy for us to handle such situations. I hope that answered your question.
Okay, ma'am. Okay, ma'am. Ma'am, okay. Thank you, ma'am, for this
Uh,
wonderful session. Okay. I hope everyone
thank,
understood this session very well.
thank you so much for having me here. It was a pleasure to be with you all. I hope this session, actually, it was just my experience, what I went through, but probably this would have encouraged you to take up nursing or to continue in nursing. I hope this has really helped you. Thank you so much.
Okay. Thank you so much, ma'am.
Thank you so much, Shilpa. It was really a
Pleasure,
very
Pragati.
eye-opening, your experience and really what we learned and what we know. It's uh, far more than that, actually. And I'm taking on screen to open all the speakers right now. I have a question from my students right now, so I would like to quote that, and then we will be moving towards the end of the session. And the question right now I received from them is how the role of nurses will change the post-COVID new world order, and how we the nurses are supposed to be malleable to such things. I would like to repeat this again. How the role of nurses will change the post COVID New World Order, and how we, the nurses, are supposed to be malleable to such things. Hope I am clear.
Too many of questions together.
I would like to show the question.
Okay.
The question
So,
is on screen. So one by one, I'll be muting you. I would like to ask this to Bindu ma'am first.
okay. So, in terms of role for nurses, will change the post-COVID new world order. So, let me do the part of it. So, basically, what I feel that is already changing. It's changing all around the world. It's the way we doing things is changing. The way we are thinking, um, and the new innovation is totally changing. So, there will be um, new innovations and new way of thinking, new ways of doing things. Um, like to talk about the UK situation, it's we had GP practitioners who would examine, assess the patients on physical, like face to face. And we never imagined 4 months back that we can do something like that, assess a patient, make a diagnosis, and give a treatment plan on virtual. So things have improved a lot. The doctors are ringing the patients virtually. They are getting assessment done on virtually, unless it's if if they can't do it on phone or they can't do it on video conferencing, then that's the only special cases they will bring the patient in to do a face-to-face assessment. But even myself, I assess the patient on phone, and that couple of months back in March, February, I never would have thought that that was possible. So altogether, new ways, technology is helping a lot. At one point, as a clinical site manager, we do have lots of meeting, lots of people come into this room, and we've got like 15 people talking about what is the situation, what is the patient flow, all the different things. Now everything is on micro team, Skype, everything is different. The virtually things have changed a lot. So I think bedside nursing and the caring bit will be always there. We will be always nurses wherever we go. What I was in 1995 when I started nursing is the same when I'm in 2020. Things have changed. Technology wise, things have changed. We have seen different things, but what as a nurse is always a nurse. They are always that caring, compassionate person, and the loving care, holding the hand of a patient, just helping with them basic hygiene needs. That's what we are doing, and that's what we are there to do. So I don't think the role as such is changed for nurses, but there's the way we are doing things are different, definitely is changing. And I think is, as all the speakers have said, is about how we manage the things, um how we mitigate the things. What we are facing now is the main thing. So we learn from each other, we learn from, it's not that UK, America, we have got more advanced health systems, but still we it was very difficult for me to even think how come we are losing so many patients, how come the mortality rate is so high. But it's about assessing ourselves, reflecting back, 3 months the down the line, we found what mistakes we've done, we learn from it, go forward, we sharing the experiences, what failings we had. So it's not everything we failed, we've done really good, excellent job, but there has been failures as well, and you reflect on it, you learn from it, and that's how you go forward about your nursing role. I think that's what I think. It's bringing a lot of positiveness about the general public in general, has been quite appreciative about the nurses. And one point we had, patients, and even the public, they've been, we have got more respect in NHS even before comparative to the other areas. But during this COVID period, it has opened new way of thinking, and public has, in general, has been quite thankful for the task we are doing. But it's not about getting appreciation. We'll have bad days, we will definitely have bad experiences as well. So it's about talking as and sharing the experiences and learning from each other. So I'll pass it to Rija if she wants to add in anything.
Thank you so much, ma'am. Over to you, Rija.
Thank you.
Yes, I totally agree with what Bindu ma'am has just said, and it is 100% true. You know, there is no denying that as key workers, nurses are at the forefront. Doctors are there, nurses are there, but now the entire nation has come, to this understanding that what a good healthcare system can do, and what a fully what you say a fully capable nurse can do as well. And now the focus, now because it has come on the nursing side, we are now truly appreciating, as a general public, as a general population, we are now truly appreciating, and we are really pleased with what the nurses undergo. Now there is like a big magnifying glass on our work, and it is projected into the entire world. The world knows now how much of nursing shortage is there, how much of nursing education we need, how much of nursing research has to be in place, how much of awareness related to nursing shortage and the scarcity of nurses, all these key things needs to be addressed. And this is what is going to happen post COVID, and it is happening right now in the UK. There have been n number of debates about the rise in pay for nurses. There is debates about car parking problems for nurses. All these things have come in picture post COVID, because now the people are aware about the situation, the issues that the nurses are undergoing, not only in one particular country, but it is now worldwide. And also, I again agree with Bindu ma'am's comment, which she said about virtual nursing. She was talking about virtual consultation. In the same way, there's so many avenues for nurses right now, and I'm talking about virtual nursing. What we are doing right now, this is what I'm talking about. This virtual nursing conference, it can be accessed by millions of people worldwide. This is a huge phenomenal step in nursing education. Webinars of such kind, discussion of such kind, this kind of awareness, this kind of talks, this is going to help so much. And that is how we are going to help in this post COVID situation, in this post COVID period, where we are going to reflect upon what we had gone through, where we can make plans and strategies for the future. And as Shilpa had rightly said in her presentation, in her lovely presentation, where she said, like, the nursing students, she had focused on the nursing students. This is the right time. We need to start at the grassroots level. We need to start where our students are, the education that they're receiving. The government need to focus now on the nursing schools. Are they adequately funded? How much are they getting? Are they in their right capacity? Do they have adequate staffs? Do they have adequate teachers? Are they having those facilities that is needed to run as a college? Can we do something more to support? Can we do something more to support our nurses? Can we do something so that they feel more empowered? All these things are going to give a compound effect, and you just see in the future the nursing career is going to boom like anything, because now people know that what a constructive field this is, what a constructive professional field this is, where nurses make a huge difference in the lives of people. We are making difference in the life of people in the past, in the present, and now and the future as well. As the technology is booming, it is advancing, everything is going to change for the good. And that is how we are going to fit into this picture of post COVID nursing victories, I must say. I pass it over to you again, Pragati. Thank you.
Thank you so much, Rija. That was really wonderful. Over to you, Shilpa. What's your opinion on this? What's your stand?
Well, I mean, each and every point has been mentioned by Bindu ma'am and Rija. I mean, I have nothing much to add on, but I mean, I just have one thought which I would like to share. I mean, gone are the days when people used to ask, why nursing? I mean, I've been asked this question a billion trillion times, you were a good student, so why are you into nursing? I mean, these questions will not be asked anymore. I mean, because the public or the world now knows what is nursing, what nursing profession stands for, and what is the exact core of nursing. I mean, what we are dealing with. It's not, as I told you, it's not just poking injections. It's more, and it's beyond that. I mean, it's a vast thing, as Rija mentioned. A lot of researchers, a lot of innovations, a lot of evidence-based practices are. I mean, it's coming together, and we're working hard towards like an improved nursing. And nursing is improving each day, and I'm sure it's going to be on its heights. It is. It is actually. Thank you.
Thank you so much. Thank you so much. It looks like we have covered all of our questions. Now it's time to ask our speakers, is there anything they want to cover before a wrap up? If yes, they can share their feelings in private chat, or any suggestion they would like to give to our students or the fellow audience who are listening right now, anything? Or shall we just have a wrap up? Shall we do that? Now, I think we are good now. Thank you, everyone. It was pleasure being with you today. I would like to request our Bursar, Reverend Father John Elias, to please give a vote of thanks.
Respected honorable guest speakers, Reverend Father Siju Matthew is our director, Benny Ma'am, our principal, all teaching staff. A very good afternoon to all. It gives me an immense pleasure to deliver the vote of thanks for this event to all dignitaries assembled here. I would like to thank our guest speakers, Ms. Bidu Varghese, Ms. Ria Abraham, Ms. Shilpa Pushpan, who honored this webinar 2020 with their inspiration, thought, values, and concept about COVID-19, Veracity, and Felicity. I extend our sincere thanks to Father Siju Matthew OSC for delivering the welcome address and for being our backbone in our endeavors and constantly motivating and inspiring us. A warm thanks goes to our principal, Mrs. Benny Susan Chaco, for your vision and commitment to work and its execution. Behind every successful program lie the manifold attempts of our committed faculty. I would like to take a moment to acknowledge the immense contribution of our dedicated faculty and staff members. Thanks to all the teachers and all the staff members. Finally, our special thanks goes to our students, participants from other colleges, making this webinar 2020 as a grand success. Once again, I thank one and all present here. Thank you very much.
Thank you, Father. Uh, Dear participants and audience, thank you for being with us in this live webinar session. We are really grateful. Feedback form you can find in the comment box below. Please fill the form within an hour. You will receive the certificates in a period of a week. Thank you once again. We appreciate you being here. Thanks again for joining us today, and we will see you next time. Have a really good day. Thank you so much.